Okay, welcome to the retrieval training video. So with this video, what I'm going to try and do is walk us through kind of a daily workflow that we'll be doing. Granted, this is a new process for us and we haven't ever done it before, so I'm sure things will come up and change, but at least this will give us a good starting point here on retrieval. So I know all of you are new to HEDIS, so I just wanted to do a little HEDIS 101 really quick. So HEDIS stands for the Healthcare Effectiveness Data and Information Set, and HEDIS is used by Medicare, Medicaid, commercial health plans, and then the health exchange. HEDIS is governed by NCQA, which is the National Committee for Quality Assurance based out of Washington, D.C. Every year they set the guidelines for which quality measures we're going to be looking at. Typically, a quality measure stays on for 10 years or so before it's retired. And the only reason a measure really gets retired is because everybody's doing it and they're doing it so well and there's not really a need to track it anymore, or the clinical guidelines changed. So one of the ones that we used to do was like, we looked at cholesterol levels for people with diabetes. Well, the research came out and said that the level didn't matter. What mattered was that they were on the medication. So they changed the guideline and the old one gets retired. So what we do is we evaluate the care that the providers we contract with deliver to our members, right? So the members enroll in our health plan. We as the health plan contract with the providers to deliver care to these members. So what we want to look at is the care that the members get from our providers. This allows members to compare the health plans kind of on an apples to apples level. So if you are a Medicare member, a Medicaid member here on the islands, you could choose Kaiser, you could choose HMSA, you could choose Aloha Care, I think there's one more. But this allows you to say, okay, this is a quality that Aloha Care members get, this is a quality that Kaiser members get. It really gives you that comparison. It's not so much used in the Medicare or Medicaid population, but it's used a lot for commercial health plans that are trying to get companies to sign up with them. It is to say, hey, you know, compared to the other health plans, you know, that offer services in this area, this is where our quality lies. Okay. So there are 80 or more quality measures, which are basically like a quality point total. Each measure has a 3-digit code and a name, but there are only 16 measures that this team will really be working on. 16 of them require us to look at the medical records. The rest of them come from claims data, or like when you go to the doctor and they bill for a service that comes from that data, or you pick up a prescription, you have your blood drawn, something like that. So this is where our project is going to be focused, is on these measures. So we look at adult BMI, adolescent well care. So these are like well checks that your kids would get every year. If you have high blood pressure, we like to look to see how well controlled your blood pressure is. For women, we look at their cervical cancer screening. Diabetics, we want to see how well controlled you are. We look for immunizations for kids under 2. This care of older adults is specific to a special type of Medicare plan called the Special Needs Plan, which we offer. This isn't something that the mass majority of Medicare members get looked at, but you know, the Special Needs Plan is for members who are at higher risk or who have low socioeconomic status and don't have a lot of support system, that kind of thing. So this is a special measure that only a few health plans do, and we are one of them. We look at colorectal screenings for people over 50, immunizations for adolescents, so you know those 7th grade vaccines that your kids need. We look at prenatal and postpartum care, transitions of care. We look at people who are discharged from the hospital to make sure that they don't fall through the cracks. We look at well child visits for kids birth to 15 months and then ages 3, 4, 5, and 6, and weight and activity counseling in kids. So those are the measures that we look at through the medical records, and so that's what we're trying to accomplish here. So HEDIS is kind of like tax season. I think I told everybody this in the interview, but basically you can't do anything before the end of the year. You have to wait until the end of the year when, and then you can start collecting all of your information. And we have till May 9th to get it all done, and then we begin an audit. So we generally retrieve records in a bell curve. So you start out, you're making phone calls, sending a few faxes. It takes a while for the providers to start sending their records in. Then they'll start sending them in droves. So we'll have a lot of records, and then we'll get most of them in, and it'll taper down during the end of the season. Here, though, we start other projects, so don't be too worried about this. Okay, so there are two main components of HEDIS medical record review. Retrieval, which is what we are doing, and abstraction. So retrieval is collecting the medical records where we think we're likely to find the information, and we have a whole logic that helps us to figure out where we think we are most likely to find the information, and then abstraction. And so this is what the nurses do. They're going to review the medical records and try and pull out they'll pull out any compliant information that they find. Okay, so we use a lot of jargon with HEDIS, and I'm notorious for this. So I just put some definitions in here to kind of help you catch up a little bit, because I'm the worst. And the nurses that we're working with and I have done HEDIS together for a number of years, and so we're all bad at it. So this is just to help bring you up to speed. So HEDIS looks at samples. So a sample is a member and a measure. So me, Carrie Taylor, I would be in the cervical cancer screening measure, and so that's one sample. Each sample has an ID number, so you'll hear like, hey, what's the sample ID? And I'll show you where that's at in the system. Okay, so underneath the sample are chases. So a chase is a member, measure, provider, and location combination. So me, Carrie Taylor, in the cervical cancer screening sample, and then my chases are, I have one to Dr. Jones at ABC Clinic. There are typically multiple chases for each sample, between 3 and 5. So I can have for me and my cervical cancer, I could have one to Dr. Jones, Dr. Smith, and Dr. Z, all looking for that cervical cancer screening. And then there's a chase ID or a number assigned to each chase. You're going to use this chase ID quite a bit in the workflow. So just know that it's that member, measure, provider, and location combination. The other thing is I could be in more than one sample. So let's say I happen to have had a baby in the last year. So I could be in the prenatal and postpartum care measure. I could be in the cervical cancer screening measure. I could be in the adult BMI measure. So it's not uncommon to see the same person in multiple measures. This is going to be especially true for our Medicare population because it's a small population. So we will get the same measure, the same member in a lot of different measures. Okay, so compliant, this means that we found all the required data for the measure. And each measure has its different compliant requirements. So for adult BMI, you need a weight and a BMI in the last 2 years, and then you're compliant. But for prenatal and postpartum care, you need 2 components. You need a prenatal visit and you need a postpartum visit in order to be compliant. So that just means that we found all the required criteria. A hit, you'll hear sometimes, that's just another word for a chase being compliant. Like we need 4 more hits. Some, you'll hear that around. So just know that compliant and a hit are kind of the same thing. Active, this is kind of a chase status or a sample status. That just means we're still trying to collect and review the data. So things can be inactive, system closed, auto closed. It means we're not reviewing it anymore, either because another chase in the sample made it compliant, or we've been through all the chases, we just don't think we're going to find it. Overreading, this is our QA process. I don't know why they call it overreading. It's just a fancy HEDIS term. Basically means QA, right? So the overread will go back and look at the data entry and the review that the nurse initially did. And so you'll hear that. Okay, So the workflow, this is kind of how it goes. So we develop the measure sample size. This is, John does this. He loads all our data and runs it all through, makes it all pretty, and then gets it all ready for us. And so then we begin we request the medical records. Once they come in, we go ahead and file them away. The nurse then reviews the records for the criteria, they overread for quality, and then the complete data is sent to NCQA. We don't send it on a regular basis. We only send it once the season's all over, but that's kind of the workflow. Okay, so let's get into the retrieval basics. And I saw I just got logged out or timed out here. Oops. Okay, let's go back here. Okay, so the first step, the workflow is going to be finding the locations that were assigned to us. And I'm going to make this bigger now because we're starting to get into the nitty-gritty. And I want you to be able to see. Okay, so once you log in, let me get out of all this stuff. Oh, I broke it. Hold, please. Come on. Okay, so when we first log into QSHR, this is where it's going to bring you. And I went over a bunch of this in the logging into QSHR video, so I'm not going to go over all that again. But what we're going to do is we're going to come here to the assignment scheduler. That's where we're going to find all of our work. I'm going to click on that. Typically, when you go to assign it, when this pulls up, you're going to have the assigned to me checked and the open checked. So now what you see here is only work that's assigned to me and only work that I'm working on currently. If you want to look at work you've already completed, you can uncheck the open and it'll show you here. If you need to look at somebody else's work, and I'll explain when you would do this later, but you can uncheck that assigned to me and then you can see them all. Okay, I'm going to go back and forth with the PowerPoint just because I want to make sure I hit everything. Okay, so in our assigned locations, there are some columns we want to pay attention to. So the first one is this due date. This is going to tell us the next day that we need to do an action for this location. Our assignment here, this is going to be the clinic name, or like a pinpoint request, and I'll go over those later. So here, like KKV is a clinic here, Waimanalo is a clinic here, and then these are ones I made up. So then we have our next action. So these are set to call back. That's not one we're really going to use. This is just a demo. But here, this one's in commitment. This one's are in all records received. So this one you can see the status of this. This one here is closed. Okay, so due date, assignment, action are the three columns we want to pay attention to. Okay, so now we found our assigned work. We're ready to start working. So our next step is to confirm the contact info. Now, Daisy has done a great job of confirming what I'm calling our top 100 sites, which are the locations from last year that had the most cases. So she's getting a head start on that. And so we'll notify somehow in the system that those have already been confirmed. But for sites that haven't been confirmed, this is going to be your first step. So what you'll do is you'll just call and verify the medical records department. You'll call the number that we have on, say, hey, can I talk to medical records? So you get over there and be like, hey, can I have a direct phone number for you? I just am wondering what your fax number is. I just want to make sure that the fax number I have on file is the correct one, something of that nature. And then you also want to try and get their name and their email if you can. It just gives us additional contact points, like if they're not returning voicemails or nobody's answering the phone, we can try and email them or something. Okay, so we need you to update this in the system for everybody to see. This will help us moving, like for next year, then we'll already have all this information. It'll also help, like if you're sick or whatever and you have a task due that day, we've already got that information. So I'm going to use this KKV clinic here, and now I want to update the information. Oops. Let me get back over here. Okay, so I clicked on the chase, the location I wanted to. Now I need to click on this faces icon. So there's two screens here. We have our assignment screen, and this is, it's got the clinic name. It'll have the description. So this is where you'll put all your comments, and they'll show up here. You can see, like here we spoke with Stacy, blah blah blah. All these comments are in here. It'll tell us the assignment status, the assignment action, the due date, which is the date you need to next make an action, and who it's currently assigned to. Okay, you can update this. So anytime you make a change, like if I want to change this to closed, I can click on there, but then I have to click update in order for it to actually change. So just keep that in mind that you do have to hit update. Please don't click add or delete. Okay, so in order to do most of our work, we need to come over to this chases icon. So once we click that, all the chases to this location will open. And if you remember, a chase is a member measure provider location. So what we're doing is we're grouping all the locations together so that, you know, all the doctors, let's say there's 4 doctors at a clinic and there's 10 chases, but we only are going to send 1 fax to that location because all the medical records are together. So we group it by location to try and minimize the, we call it provider abrasion is the technical term, but basically the annoyance we make on the clinic in requesting these staff. So if we, you know, if I sent 2 different chases for Betty here, they're going to be like, what the heck, man, I already had this chart open and getting all the records. Why didn't you just tell me at that time that you needed both, you know, you needed both or for both measures, because then they'll be annoyed. So we try not to do that. Okay, so in here you have a filter button, a run. This is like play, like getting it to refresh. And then you can see some of these chases, these options are grayed out. You can export it, which you don't really do. You can view a cross-reference. I don't know when we do that. But and what we need to use here is this view the location, the one with the house. But you can see it's grayed out. And the reason it's grayed out is because we haven't selected any of the chases. So once you click on one of the chases down here, these icons will show. So to modify the location, which is where we're going to go to enter the information that we got when we called the clinic. So we're going to click on this. This is a dummy account, so it's not letting us do anything. But we're going to use these location alt IDs to put in the information. So I have here in the training, oh, what the heck happened there? Oh, there it goes. So we're going to enter okay. So we're going to enter the contact name here in Alt ID 1 and the email in Alt ID 2. So we'll just use these 2 fields here. So if I came over here, you know, and the contact person is Janet and her name is Janet at abcclinic.com, I would enter that information here and then I would click the save icon. Okay, that way all of the chases that are tied to this location would all be updated at the same time, and then it would be updated for everybody else who needs to look at it. Okay, so that's step 1. That's one of the easier steps. The next thing we're going to do is actually fax the request. Okay, so in order to use the fax, we're going to go back to our assignment scheduler. This is where we're going to do all of our work from. And you're going to click on the location that you want to fax to in the top section, right? So this is the top section, this is your assignment, and then this is the assignment details, basically. Okay, so we're going to click on the assignment that we want. We're going to click on chases, and then in order to fax, we're going to use this little fax button right here, but you can see it's grayed out. We would need to click on one of these chases. Okay, so I want to fax this location. So I'm just going to click on either one of these. It doesn't matter. They're all going to be faxed. Well, that's not true, but we would click on this and click the fax button. Okay, so that's kind of how that's done. Oops, that Alt-Tab thing is killing me here. So before we actually send any faxes, we only want to send the active chases. So remember I talked about inactive or auto-closed chases. So if a sample, which is that member and measure, has already been made compliant from another chase, I don't need to keep looking for other chases. You can't be extra compliant. So it's just once you get the information, all the rest of them close. And so we don't want to be sending any of those. This won't be super relevant like the first fax, but as the project progresses or you're sending repeat faxes or things like that, then we're going to whittle down and only want the active chases. So we're going to click on the little filter icon next to the chase status, and we're going to select A. So all of these are I, so it won't let me filter. Let's see if I have. Oh, so here you can click and you would select A. None of these are changed, obviously, but that's the story with that. Okay, so now that we've filtered down to only our active chases, we're going to select the faxes to send. So we want to just send one fax to the clinic. Remember, we have that provider abrasion that we want to avoid. So we want to make sure we select all the chases that are now filtered. So there's a couple of different ways you can do it. My personal preference is Control A. It'll just select all of the chases. There is another way to do it. I'm not super great at it, so we're going to give it a try here. But basically, you click on one and you drag, and it will highlight them. If for some reason, like you were only sending some chases, or you wouldn't really do that in this case, but let's just pretend you need to select multiples, you can click Control and highlight multiple. That click and drag only works like if they're all, excuse me, all in a row. If they're not in a row, you have to use the Control click. Okay. Oh. Okay. So the other thing is you want to make sure all the chases have a fax number or it won't send. They should all have a fax number because we called and verified. But we want to make sure here that they, in the location fax, that they all have a fax number. Now, there's two ways. This column is kind of way over here, but you can filter down and go to location fax, if that's more convenient. Clearly it's not for me, but then it'll kind of circle and highlight it for you and be like, here it is. So just a heads up on that. Theoretically, I can reorder these, but I haven't quite figured that out yet, so stay tuned. I may get to that. Okay, so we've made sure they all have a fax number. Now we're going to initiate our fax. Okay, so we've clicked and highlighted, and we're going to click on the fax button, and it'll open a printing menu for us. Okay, so I'm going to select all, and I'm going to click our fax print icon here. Okay, so now it's going to take me to my fax or print screen. And I do have several steps that I need to do here in order to be able to send it. Okay, so just to go over this, this is the cover sheet section. We're going to have multiple cover sheets. So like Fatima has one, I have one, I made Fatima a pinpoint one. And this is because it's got your particular contact information at the bottom so that the facilities can reach out to you directly if they have any questions or need anything. So it's defaulted right now to Fatima, but I'm not Fatima, so I'm going to select Carrie. Okay. Fax or print the pull list. This needs to be checked, and we want to group. Them together, right? Because we want to just send that one fax to the provider. We don't necessarily need to select anything because it'll group it by the location facts, but I made the assignment by group, so it shouldn't need any additional grouping, but this is a demo account and I'm not really sure how it's gonna go. So we're gonna test it out and we'll see how it goes. Okay, so fax or print the data entry form. We do not want to do this. So we have to pay by the page that we fax, and the provider offices are just gonna throw these away. So we don't wanna do anything with that. Additional PDFs. So this is for faxing only, and this is something we are gonna do. We're gonna add a document here, so I'll go over that in a little bit. Preview, so you can do a print or a fax preview. Because this is a demo account, the ability to fax is turned off, and so we'll just use the print preview. We won't print, but we will fax, and then we'll use the fax manager just to check on the status of the fax and make sure it went through. Okay, so here I am at my fax printing menu. So we went over this just now, but it is here if you can't quite remember what everything is. Selecting a cover sheet. So we went over this too, but you'll each have your own cover sheet. This is Fatima's, so you can see it's got her contact information down here at the bottom. This is how the sheet looks. If you can see it, I'll show you it when we get to the print screen. But it just has this generic letter that that'll populate. It'll populate with like the clinic name, the address, all of that information will already be populated. The date will be in there, so you don't have to worry about changing anything in this type of fax. And we'll go into a different type where you do need to change the fax later. Okay, so adding a PDF. So the one drawback to this system versus other systems that I've used is that in your cover letter, you basically just get text and your logo. There's no formatting, there's no bullets, tabs, nothing like that. So in order to explain to the providers what records we need for each measure, we're going to attach a PDF. Okay, so let me show you what that PDF looks like. So it's this fax measure info, and basically what it is saying like, okay, for the adult BMI, this is the info. Oh, that was weird. Why is it grayed out like that? Let's try that again. Okay. Hopefully that won't happen again. But for adult BMI, this is the information I need. For adolescent well care, this is the information I need. So it just helps guide the provider's office to know what information we really need. So they don't have to send the entire medical record. They can just say, oh, they just want the vital signs section from 2017 or 2018. I can do that, no problem, right? And they'll send back one page. Perfect. And so this just helps to kind of guide them on what information that we're looking for. You know, you can read through it at your leisure, but this is really helpful because otherwise they're like, well, I don't know what the heck they want. I'll just send whatever I want, and it may not include what we need. So this helps guide them with that. So to add this PDF into our fax, we're going to click Add a PDF document. Okay, and then I'm just I put this right here. It'll always open to this Move It transfer screen. So we'll just always pick this fax measure info. We'll click Open. It'll be there. We have to do it every time. Unfortunately, I can't make it like a default setting, but luckily it only takes 2 seconds. Okay, so now we're going to preview because I want to make sure it looks okay. Now I'm going to use the print preview because that's the only option I have. So this PDF isn't going to show because that's it's a fax only. So it's only going to show on the fax preview. But I showed you what it looks like. You get the idea. So you click preview. This does take a minute. Even with the locations that only have a few chases, it does take a minute to load. So don't be too impatient with it like I've been, because I've had to reboot my system like 3 times today because I get tired. I'm like, what are you doing? Hurry it up. Let's go. But it does take a minute here to load. Yeah. Hold please, hold please. Okay, I'm gonna hit pause here while okay, so our document's loaded here. Oh, what the heck? Oh, I used my template. Okay, that's not what I wanted to do. Dang it. I'm gonna use Fatima's because that's the one that's really gonna, no, oh, to go back to mine. Oh, struggle bus, you guys. Hold, please. Okay, so here we can see, you know, our print preview has loaded. A couple options you could print from here. You can zoom. You know, if you want to see like 1 or 2 pages, you can do that. I'm going to tell you though that what I see here is different than what the training manual says that Inovalon provided. So in their example, it looked like this. That's not how ours looks. So, oh, but that's the facts preview and this is the print preview, so maybe that's why. Anyway, if you wanted to go like by page, it's way over here in the right. Okay, so you can see the letter pops up. It's got Fatima's contact information. And then over here, it lists the members and the measure that they're in. Now, what you should see in the stacks preview is you'll see this cover letter. Then you'll see that PDF document that we added where it has the what we need for each measure. And then you'll see this sheet. I can customize this sheet to include additional pieces of information. So I'm still working on that, but I think what I'll end up including like the last day that the member was seen there or something along those lines over here. So just don't be surprised if there's extra columns here that weren't there before. So once you make sure that this looks okay, you should be able to, like we can print here, you should be able to fax from there, which is what the manual says. Ooh, where did that go? So you should just be able to click the fax button and have it send from there. Okay, so each fax should have the 3 components, right? The cover sheet, the measure info, and the list of members. So the print preview doesn't have the measure info, but the fax one should. So once you've hit fax, you can click on this fax manager button, which we'll have once the system is up and running. So that'll take you to another screen. I don't know what it looks like exactly, but this is from the training manual that they provide, is that the fax will go from requested to document retrieved, queued, and sent. And if you click on if you want to review a fax and because you sent out this batch or whatever, you can click, you click on the fax and then you'd hit the run button here and it'll show you the details. I'm not really sure what those details are. They were not too clear about that, but we'll figure that out once we get there. With the fax manager toolbar, so it's got run, refresh. You might want to hit refresh, like if it's pending or queued or whatever. You might want to hit refresh just later to make sure it goes. Send the faxes. I think this is if we batch fax them. I'm not real sure. View in a PDF, export, and delete. They do note that if deleting just removes them from like the list, it doesn't delete the chases or the group or the assignment or anything like that. Okay, so then they have this fax status. So there's requested, it's added to the fax process, the document was retrieved, it was uploaded, queued. They only send out like once you have like 400 pages or something, or Inovalon has 400 pages. Somehow they group them together so they're not like continually faxing. So I'm not sure exactly how that's going to look, but we'll have to see. Sent, the fax was successfully sent. It'll change to sent status. Ready to fax means it's been created but not sent and placed. This is the batch faxing. Failed If it doesn't send, there's no fax machine or it was busy or something like that, it'll show you failed. Delete. Once the status of the page is deleted, it can't be sent unless you resend it. Okay. It only changes the status in the fax manager. Okay. So that's faxing. You know, I would definitely get in here and play with things. I'll try and get you all an assignment for when you start on Monday. You know, Daisy and Fatima have them, but I don't. I'll get to it. Okay. This is where it gets a little more complicated, is the tracking the actions. So it's very important to stay on top of these clinics and on top of where we're at in the status. So Fatima and Daisy and I worked together and created kind of a workflow. We are going to manage the workflow. Let's get out of here. Oops, I don't want to close that. So we're going to manage the steps of the workflow here in the assignment category or section down here, right? So I'm going to input this. I'm going to input the assignment of the clinic name, and I'm going to do who it's assigned to, and then you guys are in charge of the rest. So the status, the action, the date completed, and the description, which are basically like our comments. Okay, so let's go over the location actions first. So that's this field here. So if you click the drop down, it only has the pre-populated ones. We're not going to use these. What we're going to do is just free text. So I can just delete, and I change this one to all records received, because they sent all their records in. I do ask that you really try to match. Oh, see, I didn't even do it. You would just change it to records received. Try and match what's here in the training guide so that they're all the same, so that when I'm going in to kind of get like a leadership snapshot of where we're at with the project, I can just filter by this status, or the different statuses. Okay, so let's go through these, and then we'll go through kind of how they work. So when I first assign it to you, I'm going to put it to fax retrieval. So let's make a new, I'm going to show you how I make the assignment, so you can kind of see how I'm doing it. So I'm going to use our provider and location. I'm going to use the location table here. Okay, and then we will have done, oh, I don't have any locations. Okay, so we're going to use the provider table, and you're going to pretend that they're locations. So what we're going to do is I'm going to assign them by location key, and we are going to, you know, verify the fax numbers, verify the contact info, and roll those up to make a location key. Okay, so here I'm going to use what's a good one to use here? Oh, here's a location key. Okay, so I have all these. So I'm going to take, let's see if I can't get them to group together so I can see one that has a lot of chases. Okay, so we're going to do this one here. And what I'm going to do is I'll take this location key, and I'm going to highlight all of the sites that have this location key. Okay, so these are all at the same location. So what I'm going to do is I will end up clicking, I'm going to go to modify, I'm going to go create an assignment, and then I'm going to do it by location. Okay, so we're going to call this Taylor Family Clinic. Okay, I'm going to, let's say I'm going to assign this to Daisy. And I'm going to set the action as fax request. The reason I'm doing it as fax request is we do have some nurses that are already going to visit provider locations. And so they'll do on-site record retrieval since they're already going to be there. You'll also see here, though, that I might set a status of pinpoint chase or missing information. Oh, that won't be here in the request. That'll be up here in the assignment. So it may say pinpoint or missing information, something like that. But it'll start at fax request, and this is letting you know that this assignment is to be retrieved by fax. It should send you an email. That I've created you a new assignment. So if I end up creating you a pinpoint chase or a missing info chase, you know, I don't have to like call you and be like, hey, heads up, I assigned you more work. The system will send you an email, which is kind of nice. Okay, so I'm going to hit finish, and then I've made that assignment to Daisy. So if I come back over here, I should be able to see, here's Daisy's new assignment of the Taylor Family Clinic. Okay, so it's currently set to fax request. So let's go back to our workflow here. So I set it to, oh, hey you guys, I'm not even following my own. So it should say fax retrieval. We'll get the hang of it. It's just a new process. Okay, so we'll set it to fax retrieval. Then your step is going to be to call and verify the contact info. You'll call and confirm the oh my gosh. Okay, so your step is to call and verify the contact information, and then once you do that, to actually send the fax. Okay, then once you've done that, you'll change this here to confirm receipt. You'll also do this if you end up sending any additional faxes, like they're like, oh no, I didn't get it, or you know, they're like, oh, you know, I got it, but I can't seem to find it. Can you send me another one? You'll change it to confirm receipt. And what this tells us is this is your next action, right? So your next action is going to be to confirm receipt. The other workflows we have, we're going to have commitment. So this is, you'll call, so you sent the fax, so now you need to confirm receipt. So call and confirm that the fax was received and ask for a date that they expect to have the record back. And then you'll change it to commitment and enter one day after the commitment date. So they might not say like, oh yeah, I'll have it back to you by next Friday. They may say, usually we get these back in 2 weeks. So then you'll set it in 15 days. So that's the commitment status. Once they send records back, you'll change it. I take that back. Once they've sent all the records back, right? So all, you'll change it to records received, or you can change it. You know, if you're having problems with the site, and I've got some further instructions, you can set it to escalation. So that's kind of the basics of what this means, but I want to go through the workflow because it'll make a lot more sense. Okay, so I assign the chase to location or to fax retrieval. Okay, so then your first step is to call and confirm the contact and fax info and fax the initial request. So once you do that, you'll come over here and you're going to change this to, I better check the name first because I'm going to mess it up and then I'll be like, you guys. Okay, so we'll change it to confirm receipt. And I want to change the due date for 2 days from now because I want to give them, I mean, I don't want to like fax it and then like 20 minutes later be like, so did you get it? Did you get it? Can you check? Did it come yet? So we're going to give them 2 days. So today's the 7th. I faxed it today. So I'm going to give them 2 days, which will be Monday. So I'm going to set this to the 11th. Okay. I want to also enter my comments. So I would say 2/7 spoke with Harry, confirmed, contact info, sent the first fax. Okay. With each step I make, I need to hit update or it won't save. Okay, so I'm going to click update here. You can see it's updated my due date here. So what I can do here is I can change them and filter them in different orders. So I can see these are the things that now are past due. And my next task for this one is due the 11th. So if you kind of filter this way, like here, I would change this one, like let's say I'm at commitment, right? And they offered to, or they said they were going to have the records back by the 20th. So I'm going to change this date to the 21st. I'll hit update. Now it's going to go down, and my next task moves to the top. So this way, oops, on the due date, this way you can see what tasks are due this day or next, and keep, kind of work through that organization that way. If you feel it necessary to have additional organization, that's fine, but I do need you to do this so that I can track where we're at with the progress and make sure things are moving correctly, without having to call and bug each one of you. This allows everybody to see where we're at. If you end up being sick one day, we all can go in and say, okay, it's the 11th and Daisy's sick. Okay, I know, she sent the first fax. The status is set to confirm receipt, so I know exactly what to do. Daisy's updated the contact information. She's put in here that on 2/11 I need to call and confirm the receipt. No problem. I'll just put 2/11. But with Carrie, she states she got the record. We'll send back by next Friday. And because this isn't my assignment, it's Daisy's, I might want to put my name in. Or Daisy might want to put her name in here. I don't know. Whatever you guys find works. So I'm going to update this. So I kind of got ahead of myself, but okay, so we called in fact, and we're going to change our next action is to confirm the receipt, and we're going to set that in 2 days from now, or 2 days from the day you faxed it. So I want to give them time to get the receipt or get the fax, look at it, realize they have it, and kind of get going. Okay, so then when my due date comes back in 2 days, I want to call and confirm that they got the fax, right? That's my goal. I also want to get a commitment to return or a turnaround time. Hey Daisy, it's Carrie from Aloha Care. I'm just calling to confirm that you received our request for medical records for HEDIS. They say, oh yeah, I got it. And you're like, great. When can we expect to get those back from you? And they may say, oh, it usually takes me 2 weeks, or I'll get it to you by the end of the week, something like that. And so you'd want to make sure you put that over here in the description section. Sometimes though, you'll call and they'll be like, I didn't get it, or can't find it, or whatever. So if that happens, that's totally fine. You just fax again, and you would go, if you ended up faxing again, you would want to kind of go back to this step of call to confirm. So maybe I'll put a little arrow kind of back up here, that if you had to fax again, you would want to call and confirm again in 2 days. Okay, so once you've called, confirm they've received the fax and got a commitment to get the record, right? I need to change my action. So my next action is commitment, because I want to call again after their commitment date. And she said she would get it back next Friday, which would be the 22nd. So I'm going to call her on Monday, which was after the confirmation date. Okay, so I'm going to hit update here. And now I can see that my due date now is moved to the 25th, so I can work these ones on the day that they are due. Okay, so my commitment date comes, and I need to see if the records have come. And I'm going to go over this, how to check for the records and stuff, but we're just going to stick with the workflow because I'll get bad ADD. So if no records were received, we need to go back to this call and confirm and get a commitment date. Sometimes, you'll call and say like, hey, if it were me, I would say, hey Daisy, it's Carrie again with Aloha Care. Hey, I just wrote down that you said you were going to get the records back to us last Friday. I didn't see them come in. I was just wondering if there's anything that I can do to help, or if you have an updated time frame that you might get these records back to us. And then I would leave my status as commitment, but I would want to change my update or my date that it's due. So she says, oh yeah, I'm really sorry, I'll get it back to you tomorrow. So then I would want to leave my status as commitment because that's where I'm at, and I would just change my update to the 27th. So then I know when the 27th comes, I need to check again for the records. Oh, oops, I keep clicking on that. Okay, so let's say some of the records came. So what we're going to have to do is we need to assign those chases to review, and we'll get to that in a minute. And then I do need to call again and say, hey, you know, thank you so much for sending the records. It looks like we're still waiting on records for patients A, B, and C. You know, do you know when you might be able to send those? And she'll be like, oh yeah, I'm getting to those today, right? So then you, same steps, you come back here, you change your commitment, your due date. You know, she says she'll get them to you today, you change it to tomorrow to make sure to check the records and see if they came in. If all the records are received, which is ideal, right, we're going to assign the chases to review, which I hope I put in here on the training. And I'm going to set my action to all records received and change it to closed. Okay, so I'm going to come down here. I'm going to change my status to all records received. I before E except after C. And I don't need to change my due date because it's going to, typically I'll just have my open ones here. Oops, you can see I changed it, but I didn't hit save. I clicked something else, so it didn't save it. So I'm going to come back here. I'm going to change this to all records received. And I'm going to change this status to closed. I'll update it, and it's going to come off my workflow completely because it's done. I got all the records back. Okay, so before we do that, though, we want to make sure that we assign the records to the nurses. So let's get over to the next slide, which I think is where I put it. Why is this being weird like that? Oh, so this is just how to update the status, right? So you just free text in the action column, and then you change the due date, and you just click down like, if you saw, you can just click and it'll pull up a calendar. You do want to make sure it has a check mark in it, otherwise it won't show. So if I update that, then my due date came. My due date came off and it went to the bottom. So I want to make sure I leave it checked. I don't know what that means. Anyway, we'll pretend that that worked. Okay, so you can filter by the due date, which is what I recommend, that you have the most recent date on top. Okay, so you can just click on the due date and it'll sort it top or bottom with the oldest date first or the closest date first. Okay, so location notes, please make sure that you take notes so that we can see what each other is doing along the way. You never know, you may have a ton of actions due one day, or you may not remember what you did last time or who you talked to last time or whatever. So just make sure you leave the notes so we can see. Oh, see, this is going to go up here. So this is where you would want to leave all those notes. The other nice thing is that then you can see them here and you don't have to like click on them. You can just see all the notes here. Okay. Okay, so now we're here with the records coming in, okay? So the records are gonna come in, the records that come in by fax are gonna go to Kimiko's email. There are records that will come in, hopefully, through the provider portal, which is a secure site that providers can upload the medical records to rather than having to like print and fax them, or, you know, if they don't have the email fax or whatever, they can upload the records to the provider portal. So either way, they'll all get moved to the incoming records folder in the P drive. And let me show you that. So in the private HEDIS drive. So if you're starting from scratch, like let's say you're here in my documents, okay, you're going to click down here to quality improvement. You should have that folder. If you don't, you should have this O drive where you can go to department and scroll down to quality improvement, but you should have that in there. Okay, we are in the private folder. We are in HEDIS. Okay, it's HEDIS 2019. We are doing retrieval, and we want to look at the incoming records. Now, you can see I have these little shortcuts over here because I don't want to do that every time. I'm lazy. So what I'm going to do is I'm going to click and hold it and drag it over. And then when it says pin to quick access, I want to let go. You don't want to say where it says copy to HEDIS because that's just going to put a copy there. You want it to say pin. Okay. So if I let that go, then I have a shortcut to the incoming records. Okay. So this is where Kimiko is going to put all of the medical records. Just check it periodically, like when you, probably not when you come in the day, but like at lunch and then like in the afternoon. The nurses are East Coast time, so if you check it kind of late in the afternoon before you leave, then they can work the records in the morning before you come in. Make sure you check it with enough time to like do all the work with the record. Don't check it at 5 and be like, oh yeah, there's records in there. Well, gotta go. That's not helpful for the nurses that want to work in the morning. So it's better if like a, 4 o'clock or something with ample time, you go in and check. Okay, so now we need to separate and label the records. So with the faxes or the provider uploads, they'll just come in one big PDF. And I have a sample one for us somewhere. Let me get over here. Sorry, I thought I had this open. Okay, so these ones, oh my gosh, I still have 2 folders. Sorry. Okay, so this is all one fax from one location. Hypothetically, really it's images, but let's say this is the provider portal record, right? So it's just going to come as one big PDF with all of the records in it. That doesn't help me. I need to figure out who, like what measure this this patient is in, and move it to the correct folder. So here you can see I have like an ABA folder. I haven't gotten this far yet, but we'll have an AWC, we'll have a CBP, right? We'll just have all of them, oh my gosh, I swear I have my Catholic one. We'll just have all of the folders. So we'll get our original records. Kimiko will just place them in here. When you're done separating them, you want to move them to the original records because sometimes, I don't know how it happens whether we do our retrieval, whether a vendor does a retrieval, they go missing. So it's good if you can have the original records somewhere. Okay, so now what we need to do is we need to find out which case ID this is, which measure it is, and then save it separately. Okay, so I'm going to come over to my assignment. This is Azara Clinic, let's say. So I'm going to want to find, let's pretend this says Azara Clinic, right? Where's the one I like? So let's say that this is my Azara Clinic. So I want to come to my chases. Okay, here I have the member name. So we're going to pretend this patient is Betty, and she is in COL. Okay, so her chase ID is 41502 for COL. I'm going to come back over to my PDF, and I'm going to go File, and I want to go Print. We're not actually printing it. Please don't print on paper. But what we're going to do is print to PDF, and so that's going to make us a separate file. So I want this Microsoft PDF printer, and then I'm only going to want to do certain pages. So in this example here, I want to make sure that my fake Betty here I get all the pages that are for her. So this is her, oh, and then there's a different patient. So I want the first 2 pages to be together for this patient. So I'm going to go print. Going to take its sweet time again. Okay, it's my PDF printer. I only want pages 1 through 2. So I'm going to click the pages icon button here, and I'm going to enter the pages I want. Okay, then I'm just going to hit print, and it's going to come up with a save option. Okay, so good thing I put my little shortcut here because it's going to take me wherever it wants. This happened, remember, with our test was a COL. So I'm going to make sure I have, oh my gosh, my folder. Okay, so I'm going to put it in COL. And I've already forgot my Chase ID. So I'm coming back here with Betty, 41052 COL. So I'm going to do 41502. I'm going to do an underscore, and I'm going to do COL. Okay, this will tell the nurses when they get to their workflow which Chase it goes to and which measure. Okay, so once I do that, I'm just going to hit save. It'll take a little minute to convert it, and then it'll be ready for the nurses in the COL folder. Okay, so the nurses will come in here and then grab these records to work. So now that I've confirmed that this Chase has come in, I want to make sure I assign this one to the nurses to review. I'm going to right click on it here. I'm going to click modify, and I want to do the Chase assignment because I'm assigning it to the nurses to ready for review. Okay, so here's my ready for review. I'm just going to click on this. I'm going to set it to a Chase status of record received. I don't want the check mark here in the name in this instance, and I'm going to click OK. So now when the nurses log in and do their workflow, they'll see that that record has come in and it's ready to be reviewed. Okay. Let's go back to our PowerPoint to make sure I didn't miss anything because I just kind of started going. Okay, so we'll have the facts in one record. We need to separate each member's record into a separate PDF. If that member has multiple chases for multiple measures, we need to save it a couple of times. So in this instance, see this member here, Matthew, is in the MRP and the TRC. So let's say, like, we'll just say this one is that Matthew patient. So what I'm going to do, this is page, I need to use this page number here, page 4. So I'm going to print right, I only want to print page 4. I'm going to click print. Okay, and let's see. This is 96676 and MRP. Okay, so I want to get out of my COL folder. This is MRP. We'll make us a little folder here. So 96676 MRP, and we'll hit save. Okay, now we have to do it again. Right, so we'll come over here. We'll hit print. We just want page 4. Okay, and this time it's 119040 for TRC. So, oops, come back over here. Need a TRC folder. What was my Chase ID? 119040 TRC. okay? And unfortunately, you just have to save that twice. There's no real way to efficiently there's 1,000 ways to get around it, but no really efficient way. Okay, so now I've done both of these. So I'm gonna come over here, modify. I'm gonna make my chase assignment ready for review and chase assignment record received. Okay. If I hit run, which is basically like a refresh, it should show me over here, my chase assignment is record received under ready for review. Okay, let's go back to okay, so we saved that record for the 2 different chases, and we'll also need to, we saved all the patients, we'll say. So these were just the steps that we went through. We clicked print, we made sure it was a Microsoft print to PDF, we entered only the pages we needed, and we clicked print. Once we did that, it'll bring up a save box, or a save box. And we want to make sure we save it with the HR Chase ID and the measure key. Now you'll notice at the end of the measure key, there's like a 19, a 19A or B. Just ignore that. We just want the 3 digits, the 3 letters. Okay. So in these examples, we have 617. Excuse me, I'm using the wrong number here. 6415, right? We want to use the Chase ID, not the sample ID. So we do 65415 for ABA, 50164 for CDC, 63881 for CDC, 14428 COA, right? We want to put them in the associated folders and click save. Okay, so finding the Chase ID. The Chase ID is in QSHR. If it's assigned to you, you'll see those chases. But if you're looking at a fax that isn't for one of your locations, don't be a goober and be like, oh, that's not mine, I'm not doing it. Just uncheck the assign to me box, find the clinic that the records came from, and then match the Chase ID and the sample or the measure and put it in the right folder. Okay, once you're done with the original fax, change the document name to the clinic name. Okay, so here, if we go back to let's say this is the original, right? If I right click and I can hit rename, because what'll happen is it'll come up like 808, right? And then it'll be like all this weird stuff. Okay, that's not helpful for us to find it later. So right click and rename, and we'll say this is Taylor Family. If you can spell. Okay, that way it's just easier for us to find it later rather than having to go through all these weird fax numbers. Okay, tips and tricks, I went over this, but this is just how to pull it over to the side so it's easily accessible. Okay, so that's it for our kind of renaming and saving. I kind of did this step, the notifying the nurses as we went along, but let's go over it again. Okay, so once you save the records, you need to assign it for review. If you want to select multiple records at the same time, you can just hold down and click or control click on each one of them. You're going to right click on the chase, click modify, set chase assignment, and this one says review. I changed it to ready for review because that's what my nurses are used to seeing. Okay, so that's now set to ready for review. So then we're going to get that pop-up. We want to assign it to record received. We're not going to assign it to the person, and don't check the date in this situation because then it's harder to filter for the nurses. And then just click OK. So once all that's done for the clinic, you're done for that location. I'm going to tell you that we estimated that each one of you will have like 125 clinics. So it's kind of, you know, it's a lot of work. Last year we started with 9,000 chases. We got about 5,000 in. So, I mean, it's a high volume of records. Sorry if you can hear the vacuum. I guess I have to stay too late. Not housekeeping. You know what I mean. Okay. So other request types. So that's kind of the bulk work that we'll do, where we try and get all the records at the same time for the clinic. I touched on this briefly, but if I make you a new assignment for like a pinpoint chase or a missing info chase, you'll get an email. This is from their training manual, but this is kind of how the email will look. It'll come from qsalerts@inovalon.com, so don't delete those. Those are telling you that you have a new assignment. It should tell you, it'll, you know, tell you the description and that kind of stuff, and how many chases are in there. So just set that with that. Okay, pinpoint chases. So sometimes during medical record review, the nurses will find that the information we're looking for is at a different location. They will check to see if there's already chases created to that location. If there is, they'll just move on. But if there isn't, they'll send it to me and say, hey, I think we need to make a pinpoint chase to this location. And these are typically chases where we're just seeking out one piece of information. So we may, you know, go back to the patient's old clinic and say, hey, can you send us the pap smear that they had done, or, you know, whatever. And so when they're assigned, rather than putting the clinic name in the description, I'll put either missing info or pinpoint chase. Okay, so that way you know that they're different than just the clinic, and they should only have like one chase, unless like you know, we may have a couple of chases to this clinic where they didn't send the growth chart, and we may have a couple of chases to go back and get that. So I can't say how it's going to be done, but I will try and label it pinpoint chase. See, I'm not calling my owner because one's capitalized and one's not, and so they won't. I can't filter the same way, which is but that's okay. So missing information, these are cases where the provider's office has sent back the medical record, but not all the information. So for some of the measures, okay, sorry. So with some of the chases, like we can tell that the doctor ordered the blood test, but they didn't send the blood test results back, or we can tell that you know, the provider measured the height and the weight, and they measured the BMI, but they didn't actually send the growth chart. So we can go back and request those pieces of information. And when we do that, the faxing is a little bit different because you have to modify the template. Okay, so if we're here with this one, we want a BMI growth chart. So I'm going to click on it like I did with the regular faxing. I'm going to click on my fax button. And then instead of using my first attempt fax, I'm going to use my pinpoint fax. Okay, but I have to edit it because I want to tell them exactly what information I am looking for. And this isn't actually a pinpoint, like this BMI thing would be a missing information. So let's pick a different example. Let me get out of here. So this one is this is a missing info test, but we'll just pretend. So get the A1C results from 11.5, and I'll leave you notes like this about what we're looking for. Okay, so I need to pick a different template. So I just clicked on my drop down and I picked the other template, and then I'm going to click edit because this template comes with like X's in it that I need to replace. Okay, so it's going to pop up like this. And you can see the template has X's in it. So if we go back here, oh, apparently can't do that. So we come back here, I want the A1C from 11.5. I'm going to click edit again, and I'm going to change this to say, I want the A1C results from 11/5 of 2018. Okay, so I'm going to click OK. If we don't leave a year, assume it's 2018. So I'm going to click OK, and then that updates just for this one chase with that information. If I hit preview, hopefully it won't take too long to load. Hopefully. I wasn't this slow earlier when I was dinking around with it. Oh gosh, so boring. Okay, so now I can see I have my pop-up here, and I've got my custom template for the missing info. So thank you so much for sending the medical records for our HEDIS project. It looks like some of the information may not have been included. Please, for the following member, can you please send the A1C results from 11/5 of 2018? Thank you for your prompt. I clearly need to fix this a little bit, but you get the idea, right? And then it'll include the covered page again. So for this patient, I need the A1C. Okay. So this just tells you how to modify it, right? We just went through that. Okay. So that's the nuts and bolts of like the process. I'm sure we'll have a lot of modifications as we learn and grow together. You guys are new. This is a new software for us. So we're all learning how best to do it. If you find something to be cumbersome or you think we could do it better or something like that, just let us know and we'll talk about it and figure out if something we want to change. I will warn you though, I play the devil's advocate. So we were on calls today and they were like, well, why don't you label it like this? And I'm like, okay, well, what's the benefit of that? Well, it's nice to have the name. Okay, that's nice, but that's not really a reason to add extra work to somebody else because it would be nice, right? Like I want to make sure that there's a rationale before just adding work to people. Okay, so on-site retrieval requests. So this is the first year that Aloha Care will not be offering to come on site to collect these medical records. It was something we did in years past. It's not time efficient and it's not cost efficient, right? Because you have to go to 4 or 5 other islands, you know, drive all over the place, rent the car, then you're out, you know, you're out all day on the flights and driving around. It's just not efficient. So we are no longer offering that. And there are clinics that are not going to be happy and you're going to hear about it. And that's why in your interview, I asked you to tell me about a time when a customer wasn't happy because these customers are not going to be happy. So, you know, you'll send these faxes. If you look at the fax template, let's see, let's pull it up here. All right, so this is the template. So we offer 3 methods for them to return the records. So the first is to fax it. The second is to upload it through the provider portal. And then we do offer remote EMR access for our nurses to go collect the records. So we will do the work to get the records, but we're not coming out to your site to do it. You can set up remote access for us. It's something that's super easy to do. Clinics can do it. It's just a matter of it hasn't been a priority for them in the past because we'd come out. So why would they do the extra work when we'll come out and do it? So we do have this in here this year. If you would like our nurses to access your EMR remotely, please contact me immediately. We will not be able to come to the office to collect records from the EMR. So this is new this year, and you're probably going to get some unhappy calls. They don't have time, blah, 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 you know, you've done it in years past. Somebody's always come. We've never had to do this, and that's fine. They can be mad and upset. We are happy to do the work to retrieve these records through remote EMR access. But if you don't want to set up remote EMR access, then they do need to provide the records. If they get really ugly or they ask to speak to a manager, just send them my way. Actually, what I would prefer you do, I'll put this in here, is get a name and a callback number and send it to me. And I'll be happy to call them and give them the business. Okay, so refusals. So this happens all the time, right? People drag it out and they'll be like, yeah, I'm getting to it, or they won't answer the phone and they won't answer they'll never reply to the fax. But we're gonna be on them this year. We're really gonna try and get back all these records. So if you're talking to a provider's office and they're like, yeah, we got it, we just don't have time to send it, we're not gonna be able to participate this year, or blah, blah, blah. As part of their contract with Aloha Care, they are obligated to provide these medical records. It's not optional. That you can say, oh gosh, I wish we could, but we're just short-staffed this year and we don't have the time. They are contractually obligated to provide these records, and if they are unwilling to provide them, then we escalate to provider relations, who is responsible for continuing our contract with them, and that contract can be removed if they're not willing to participate in these efforts. So if a location attempts to refuse, first remind them that it's their contractual obligation to provide these. If they refuse to call, what I would do, because typically you're talking to the medical records person, right? So if they refuse, you can try and call the main number and speak to the office manager and explain why we're requesting the records and remind them of their contract. If they refuse, though, after 3 attempts, get that name and contact number and get it to me, and then I'll work with provider relations to gently remind them. We also have like our chief medical officer that can speak to their physicians and remind them of the importance of these things, and that actually the clinics make money when we do well. So the providers participate in what's called pay for performance. So the more members that are compliant from their locations, the more money they make when they have claims to us. So it's in their best interest. So typically it's the office staff that's like, I'm not doing this, I don't have time. And so we can get, once we get provider relations and the medical director involved to talk to their doctors, it's usually seen in a different light and those records come over. Okay, so that's the nuts and bolts of retrieval. We are all going to learn and grow together. So don't take this as a Bible. I will update this though, because I do like us all to have a reference. And plus, if we update as we go, then it's ready for next year. So just keep this handy, refer to it often. And if you see something that you think could be done better, let me know, because I'm totally down for that. So, all right, we'll talk to you guys later.